Good afternoon, everybody. Valentina and I are really delighted to be here with you this afternoon to share our passion and our insights into D&I in the workplace. We're going to talk to you a little bit about some of our research, employee and employer research that we've just released, and give you some flavours about what's happening in the region, so both within the UK and across Europe in the D&I space. We'll also spend a little bit of time giving you some insights as to what leading employers are doing in this space, and how you as organisations can look to design and implement really effective D&I strategies. Before we do that, and as Aidan very kindly set me up, we'd just like to do a little bit of interactive exercise with you just to get you in the right frame of mind for D&I this afternoon. And I'm conscious we've got the post-lunchtime slot as well. So when I was prepping for this session today, I spent an inordinate amount of time thinking about what I was going to wear. And for those who know me, that's not something I regularly do. I'm quite laid back when it comes to it, typically a jeans kind of girl. But when I present, this is something that actually takes up quite a bit of my time to think through. So I was just going to ask you to stand up for me. I'm not going to ask anybody to do anything with their outfits, I promise. But what I would like you to do is to stay standing if your outfit today doesn't have a belt or a waistband, or doesn't have a jacket that you could attach something to, or if you haven't presented today. I'm looking at Karen for that. But so if you stay standing if you haven't got something you could attach your mic to. You got a waistband, I promise. Part of what I was doing with this is this whole AV setup for presenting was designed by men for men. It hasn't been evolved when women have started to present and be more engaged. And you can sit down, please do sit down. And actually, when you present, you need to spend a huge amount of time as a woman thinking about, have you, I promise I won't dislodge my AV, but have you got something you can attach your mic to? Is it all going to stay in the right place? Are you going to have to hold it on top of needing to concentrate and present? And part of the reason for me using that example, to get you to stand up obviously and be awake for me this afternoon, but is around this piece of unconscious bias. So it's everywhere around us. And Valentina and I are going to talk to you a little bit now about DEI, but we're going to focus quite a lot on the equity piece in that and challenge thinking in that space. Valentina, hand across to you.
Thank you. So everyone's very familiar with the term DEI, I and D, D&I. There's various different DEI and B. But really, what do those terms mean, and particularly in the context of benefits? So from diversity is obviously diversity of your workforce, and trying to increase that diversity, particularly within certain industries, we really see the need to create more diversity. And diversity, even though everyone thinks mostly from a gender perspective, is not just about gender. And you can see sort of on the slide a few other examples. Is LGBT, is disability. That is not something that is spoken a lot about, both visible and invisible disability, including neurodiversity, if we want to bucket that, and sort of non-visible disability, ethnicity as well, and generational. So with people with different ages, and ageism is another problem that we see. So it's really creating that diverse workforce from across all the spectrum of diversity and different cohorts. Equity is all about giving people the same opportunities and the same outcomes, really. So it's quite different, as we will see in a moment, from equality. Equity and equality are two different things, particularly when we think about benefits. And then finally, inclusion is really what brings it together. It's a culture within an organization, is what allows you to maintain that diversity. So not only create it in the first place, but also be able to maintain it, which is another struggle we see with employers putting a lot of effort into creating that diversity, and then sort of if they're not doing the right thing, then it's hard to maintain it, and people just leave, really. So really talking about the difference between equality and equity in the context of benefits. So here are just some examples, but equality might mean, for example, in the context of medical benefits, it might mean allowing people to include a spouse as a dependent in a medical plan. Equity is about ensuring that that spouse, no matter what the definition is of that spouse, including same-sex partners, particularly in some markets where that's not necessarily a given. If you think of life insurance, it might mean making sure that in some countries actually the life insurance is defined as a lump sum, as an amount rather than a multiple of salary. So is that amount appropriate for the different people? If you think of retirement benefits and employer matching type structures of DC plans, is that type of structure affordable to everyone? Perhaps people that are working part-time for a period of time, or the lower paid people within the organizations, are they missing out on that employer contributions because the plan is contributory from the first level of contribution? So there's lots of examples there where equity and providing the same thing to everyone, one size fits all, actually does not mean equity. So equality is quite different from equity. Another example might be from a communication perspective as well. So same platform to everyone, great that there is that platform of communication, but again, not everyone might communicate and appreciate the same channel of communication. Is written communication better for some? Are people that are visually impaired perhaps needing a different type of communication? And of course the obvious one, especially when you're multinational, it's languages. So really thinking through all the aspects of benefits, from the eligibility aspects to accessing the benefit, waiting periods, design of the benefit, through to how it's communicated, and thinking how would my people experience that, no matter what cohort or what diversity group they belong to, but also what time of their life they belong to. So if it's older people or younger generation, if it's someone that's just been on leave and coming back into the workforce and perhaps are going part-time for a period of time. So think of diversity as those sort of different cohorts that we saw in the previous slides, but also in the moments of life, and really try and think of what would the outcome be for the different cohorts in the design of my benefits. So now over to Lucie, just to take us through a bit of that research that tells us what employers and employees are doing and seeing.
Okay. So from an employer standpoint, I'm going to present two pieces of research for you this afternoon. We've got an employer view and an employee view. So from the employee perspective, which is our Global Benefits Attitude Survey, and we published this last month, so it's really current. What we're seeing is that DE&I continues to be really important for employees in the UK workforce, and this is UK data, so it's not across Europe. And what we see is that DE&I ratings, so how employees rate their employer, have an impact on engagement and retention. And what we also see is that UK employees don't feel that employers are making progress in this space. Now, whether that's fair is debatable. It could be down to something as simple as how progress on D&I is communicated by the employer and how well the employees understand that. So coming back to the point Valentina was just making on ensuring your comms programme resonates with different employee demographics. But what we also see is where we have a high DEI rating, so when we're looking at employees who think very highly of what their employer is doing, it's those more privileged employee groups that are more likely to give a high rating. So people who are highly paid, people who are in a white demographic. And you can see in the bottom right that this is reinforced when we look at underserved populations in the workforce. Less than 50% of people in those more minority demographics are likely to say that their benefit programs do not meet their needs. And we know from our research that employees in these groups also exhibit lower levels of well-being. So they have a lower well-being score. They're more likely to be striving rather than thriving in the workplace. So it clearly has a really significant issue, or a really significant challenge. And then what we also see is these underserved groups place a higher priority on D&I in the workplace. So it's a huge focus for them. And something that I'll show you comes through when we look at this from what we call our equity index. So this benchmarks employee views of their employer across 6 different areas linked to D&I. So pay, career, L&D, and things like safety and inclusion in the workplace. And when we produce the scoring, the percentage, we're looking at employees who rate their employer favourably in 4 or more of these categories. And for me, what this really illustrates is there is more to be done. So 55% of all employees are telling us that or 55% think that their employer is doing well in this space. If we then look at what's happening with employees who report that they live and work with some kind of disability, the score there is much lower. And this, again, for employers, is something we really need to think about. We can't just rest on this. There's more that we need to do, and it's super important when we're thinking about these underserved groups in the workforce. So, we were going to stop and pause for a quick poll, if that's okay now. This is a multi-choice question. So what we'd like you to do, please, is in order of what you view to be the importance for your organisation, rank what external factors are having the biggest impact on your wellbeing strategy and programmes at the moment. I think most people are done, so we'll probably close it there. So if we can close that out and move on to the next slide. Flick through, there we go. When we asked this question in our most recent research of employers across Europe, actually from a UK perspective, the emphasis was D&I. So that was the factor that most organisations responding to our latest wellbeing research said was influencing their strategy. The focus is lower for Europe. It's still in the top 2, but you'll see that there's quite a differential. The Europe data includes the UK. So I think if we took the UK out of the Europe data, this would drop to a much lower level. And I think what's interesting, both with the response in the room and the response we're seeing for Europe, is we know that pay, and with that benefit equity, is coming. So it would be legislation across the region in the next, Valentina, 2 to 3 years. Valentina will talk a little bit more about that later. We know organisations need to be doing more. We expect it will happen in the UK if we have a change of government next month. So for us, it's quite interesting that across Europe, there isn't this focus on inclusion in benefits and addressing the disparities and what that means for an organisation. I would also say that in Europe, what we typically see is a view that state provisions and legislations are much more inclusive. There's a much more inclusive health system. Access is better. Whether that is actually the case when you look at some of the restrictions around access to inclusive support and health benefits, it again is something we don't have enough time to discuss today. But I think it's important to apply that lens of there's cultural differences. People have different expectations in continental Europe as to what their employer should or shouldn't do in this space. So in terms of what we're seeing as an emerging focus for organisations within Europe, and again, this is the employer view that we've just published this month. What we're seeing is employers are starting to focus, we said this, so we've been saying this for the last 12 to 18 months, we're seeing a focus back into the more traditional physical area of wellbeing across Europe for employers. But what we're starting to see is employers focus in and personalise and tailor what they're doing to those employees who are in these underserved groups. So it's a more traditional focus area, but actually it's got a lens of inclusion, diversity and equity applied to it. What we're also seeing is employers really focusing in on digital. So they're looking at how they can personalise and enhance and coordinate that employee experience and doing much more in this space to leverage technology. And I think it'd be remiss of me not to call out that red downward arrow that stands out there around employee listening. So we are seeing a trend towards employers doing less listening. And I don't think that's because they don't care about what their employees want or need, but actually advances in technology and AI mean they're far more likely and able to tailor and personalise and meet those needs without needing to do quite as much work in that space. If we then drop back to an employee lens and keep this communication theme going, what are we seeing from employees when it comes to effective communication from their employer and what's driving them to take action? I think what's really key here is if you have employees who are well informed about their benefits, they understand the programs and their health issues, they have a supportive management structure, and they feel that wellbeing is really embedded in their culture and really important within the senior leadership of their organisation, they are 2 to 6 times more likely to be proactively doing something to improve their health. And what we then see from the employee reported research we've just published is they're less likely to be absent, they're more likely to be productive, all those things that you know. But I think from a VOI case study or story, when you're thinking about how you justify wellbeing, DE&I and those strategies and budgets within your organisation, you don't get much better than this for the evidence about the impact that it has. So before I hand across to Valentina, just quickly, what are we seeing really highly effective organisations doing now, and what are we seeing them planning to do in the next 2 years? What's differentiating their performance? What do we think, or what are they doing? What do we think we should be taking note of? It's again this theme of personalisation and communication. So they're really dialing into digital strategy. They're really dialing into embedding DE&I into their wellbeing and the culture within their organisation. And in terms of the next sort of 2 years, that theme just amplifies. So they're going to be doing more in the digital space, more storytelling, more pulling it together, and they're going to be doing more around that whole kind of like DEI piece within their employee experience, but really making sure their benefits are addressing those underserved groups.
So what are some of the tactical activities that some of our employers and clients are doing? If you look at the 5 dimensions of a benefit strategy, being portfolio, sort of what is it that is offered, how is it financed, what is a talent experience, how is it operated, and then the analytics around benefits. Here are some examples of what employers are doing. So within the portfolio, so the what of benefits, a lot of focus on family benefits, both in country as well as on a regional and global perspective. So parental leave benefits is a huge trend that we're seeing. Sometimes driven by legislation. So we've seen a lot of legislation worldwide really on either harmonizing, increasing parental leave or harmonizing between maternity and paternity. So that is driving some of this interest, let's say, but it's also sort of comes from the employers. Flexible working and returning to work as well, and mental health, as we've seen before, sort of mental health being a huge priority of a lot of employers. From the financing side, I just pick on the insurance solutions. Many employers are starting to use their relationships, particularly the ones that have pooling arrangements or captives, to actually use a captive to drive their D&I strategy. So not anymore as a financing vehicle, but actually how can the captive help me to implement some of those sort of harder benefits to implement. From a talent experience is purpose and culture. So a lot of that connection, seeing really what is the purpose of an organization and the culture within the organization, and sometimes even the business, and try to connect that to what they're doing for their employees. So we see companies in the pharma industry, for example, doing health-related or fertility-related benefits, for example, or in the financial industry doing things that are related to financial awareness and financial education, because there's that sort of connection of what we're doing for our customers, we want to do as well for our own employees. From an operations perspective, is all about sort of vendors and making sure that those vendors are meeting the needs in terms of communication and flexibility, just as Lucie was saying earlier. And then from the analytics, really the compliance aspect, which we'll talk a bit more later in the context of the EU pay transparency, but generally compliance as a whole, there's a lot to deal with, and a lot of that is related in some cases to D&I. Corporate social sustainability directive and reporting as well has a sort of profound impact on D&I, and governance and measurement as well. So as anything, you need to start measuring to then be able to monitor progress and see what's working and what's not. So here's some of the really tactical things that employers are doing. And within the portfolio, one other sort of tactical example of what employers are doing is assessing their benefits from a D&I perspective. So looking at the finer detail of the benefits, and are they working fairly for everyone. So not just look at the really obvious things like, do we have a fertility program, or is there gender affirmation programs included in our medical? Those things are important, but also look at some of the aspects that I was talking about before. So eligibility, are there waiting periods? Is there flexibility when you reach retirement to, for example, take a bit of retirement and workings to meet those needs of that older generation? Or the return to work programs, or the DC sort of contribution structure and benefits, or eligibility again to same-sex partnership benefits. So lots of aspects within all the benefits, really, from retirement to your leaves, to your medical, your risk benefits, and looking at them under that lens to really see if they're working fairly for everyone, and then see what are the tweaks and what are the gaps from a best practice perspective, in some cases also from a sort of market perspective, what is possible from a cultural and legal perspective in each of the markets, because not everything is possible, and obviously budgets as well are limited. So really trying to understand a little bit how to prioritize between all the various sort of ideas and gaps that would come out from this type of assessment. And we see these assessments being done to meet many different needs, and I'll just call out some of them. So industries needing to create more of that diversity. So lots of our clients are saying, we are in an industry that has underrepresentation of women, for example. How can our benefits help meet that need of attracting more and also retaining more women in the business? Enhancing EVP. We talked about that earlier, but also meeting ERG and key stakeholders. So we hear a lot of sort of noise in the nice way coming directly from employees and the representatives of those employees, and then employers acting because they heard that feedback. And combining all of this as well with a broader total reward equity. So it's not just about the benefit piece, it's also about career equity, it's about pay equity, and how do all those things come together with well-being and benefits to really create that fair and inclusive experience for employees. Just our framework to assess where employers are in relation to best practice in each of the markets is sort of this maturity spectrum that you see on screen, being from compliant to the initiating. Employers might be just ticking the box of what the latest thing is that they have to do. So a country that has implemented menopause leave or menstrual leave pause, okay, we're doing that, but they're almost always in the back foot and just doing what they have to do. And compliance is driving a lot of doing the good thing anyway. So they're still good in being in that bucket. Advancing is starting to do a few more things, perhaps driven by HR, and perhaps also by corporate sustainability as well, but still quite isolated things. So, okay, a parental leave program or a fertility program or something like that. And then leading is really starting to bring those things together and looking at more broadly, so doing some of those assessments, for example, that I talked earlier, and looking at all aspects of benefits and not just isolated aspects. And then finally, transforming is those organizations that really see everything under the lens of D&I. So it's not just limited to benefits, is the total rewards, is how we communicate, how we live, what are leaders saying, and what is the message that leaders are sending out. So that's really the maturity spectrum. And here are some screenshots and examples of what the outcome of some of these assessments might be on a multi-country example here you see on the sort of back right-hand side. And a sort of heat map indicating, okay, we have a problem across communication in all our countries, or we have a problem in all areas in a specific country. So that idea of a heat map really allowing employers to prioritize either a market or a particular area within benefits or a particular benefit itself to help a bit with that prioritization. And then obviously these assessments have to be put in the context of what the cultural and legal background is in that country. So great from a HQ perspective or multinationals wanting to create that consistency, but that has to fall and be implementable in each of the markets. So a quick Slido, there you go. So having seen that maturity spectrum of sort of initiating, advancing, leading, transforming, where do you see yourself and your organization? Advancing, winning there. So that's sort of the step beyond the compliant, which is good. And we definitely see lots of companies, when we ask this question, where are you now and where do you aspire to be in the next 2-3 years, there's always that wish to be more on the right hand side. Oops. And so before we go into the last quick topic, another quick poll around the EU Pay Transparency Directive. So for those who have responsibility or have employees and entities in Europe, you've probably heard about the EU Pay Transparency Directive and that there is a benefit aspect to the directive. So we just wanted to understand if you are aware about this and where you are on the journey, really. Okay, so a good proportion, let's say, that are not doing anything yet on benefits or on the whole directive, but are aware of it, and some that didn't even know that benefits are included. So hopefully the next couple of minutes will be useful to you. So just on the left-hand side column, just a few really highlights of the key provisions in the directive. So I'm not going to go through them all, but I think the key takeaways are really that the directive came in force in April last year. In June is really when it kicks off, and then from June, all member states will have 3 years to transpose the legislation into their own national legislation, and then after that, companies will have 1 year to comply. So we're looking at June 2026 for member states to turn it into their own legislation, and then June 2027 really for companies to start reporting under this directive. The other key takeaway is that benefits are included. It doesn't help that the name of the directive is EU Pay Transparency and doesn't mention benefits, but in the directive it defines benefits are including all types of pay, variable pay, complementary pay as it's described, including benefits in cash and in kind. And I think it's not surprising, and it's really good that they've included it, because benefits we often see that are perhaps a 30% proportion of the total reward package. So it's great that they have been included. And a sort of a bit of a misconception in benefits is that, just as we were saying before, that the same benefits, I provide equal benefits to everyone, and therefore, I don't even need to include them in the directive. So one, as we saw, benefits don't necessarily work equally for everyone, even though you might be offering the same benefits to everyone. And two, even if you do provide them equally to everyone and they have an equal value, let's call it, they still need to be included in your pay analytics. Then in terms of justifying any pay gaps and pay differences, you can start removing those to come up with your, let's say, clean numbers, but in the first instance they have to be included. So those are really the key things that you have to think in terms of doing. And what we see is the benefits will probably fall under 3 buckets. One bucket where it is causing a difference in pay, and the threshold in the directive is 5%. So you will have to remediate any gap that is 5% or more. And benefits are often the cause of being above that 5%. In a lot of cases, those gaps can be justified because it's either flexible benefits, people are using them and some are not. So those things are justifiable differences, let's call them. But where they're not, you will have to do something about it. So that's sort of one bucket of, there is a explicit discrimination in the benefits. Someone has been offered something and someone else has been offered something different within that same category of employees. The second bucket being an indirect discriminate or an indirect difference or gap, let's say, and that might be a situation when there is some flexibility and choice from an employee perspective, and so the fact that the benefits have a different value, it's not to do with the employer having any discrimination. Is just the way employees use the benefits. So that is let's say a good to know from an employer perspective. And then finally, the last bucket is again the ones that are not anything that you have to remediate from a compliance perspective, but are things that perhaps might be telling for you as an employer. People don't engage, women are not engaging in a particular benefit compared to men. So what is that telling you? Could I be doing better from a communication perspective? So those are, I know I went through it really quickly and there's some technical aspects to it, but happy to answer any questions in the Q&A. We had a couple of case studies to go through, but I know we're sort of running out of time, so I don't know whether we want to now open up to questions and maybe use some of the case studies in answering those questions. The two case studies were from a multinational that did a broad over 30 plus countries D&I benefit assessment, and the other one was for a client that has implemented a global parental leave benefit.
Brilliant. Thank you very much. Yeah, see. Brilliant. So we're now in the Q&A section, everyone. So if you do have Slido, you want to ask any questions, please do ping them on there, or feel free to put your hand up. We do have a mic going around. But just while people are thinking of their questions, putting some on Slido, one of the biggest things I've seen across all of our research when we ask people around barriers to change in their strategies, number one reason across the board is always budget. So my question to you both is, what happens if you don't have the budget to balance the need for standardised benefits packages with the diverse needs of their specific workforces?
So I think there's a lot of things that can be done at low budget, like communication, for example, starting to communicate better what you have, filling in some of those gaps, exclusions, for example, often just looking at your policies and making sure that you've removed all possible exclusions, things like suicide exclusions or HIV exclusions. Those type of things can often be at no cost or very little cost. There's quite a lot, and when we do these assessments, we see that there's a number of quick wins. So, D&I benefits doesn't only mean the ultra expensive fertility treatments, but can also mean just some quick wins. I don't know, Lucie, if you wanted to add something.
I think I'd just overlay on that, a lot of work my team do is helping organisations think about what have we already got and how actually can we package that slightly differently so that we're thinking about a particular demographic. So again, if we take reproductive health as a good example, what have you already got in place that perhaps doesn't immediately connect for your employees to their particular circumstances? So you have an EAP, actually that could lend some counselling support for people who are going through a particularly difficult journey. You have your healthcare programme. What's included in that already that they might be able to use and leverage for diagnostics, for example? So it's thinking through those more personalised journeys and then being really creative and smart with what you've already got and how you position that for different groups.
Brilliant. We've got a few questions coming in on the EU Pay Transparency Directive,
Yes.
so I think fair we should address them. So the top one there is, does the EU Pay Transparency Directive include the UK?
No, it doesn't. It doesn't. So the EU is every entity in the EU will have to report for its entity. So it's at entity level in the EU. The UK is not included, but the potentially new government in their manifesto have already said that, although they haven't explicitly said that they will transpose exactly the EU Pay Transparency Directive, but they did say that pay equity is one of their ambitions. So, if it comes into force in the UK as well, it's probably going to be something very similar. The other thing as well we're seeing is that for multinationals, it's taking already that view of let's do this globally anyway and not just in individual markets, because we're seeing that similar legislation popping up in various countries. And also from a messaging perspective, it's going to be very difficult to say, you give the transparency to a group of people in the EU and not in the neighbouring, UK and Switzerland, for example. So already from the first instance, trying to take that global view.
And I think last one before we finish today, the top one on that list there, the pay transparency may increase salary conversations. When salary bands are visible, what tips do you have for addressing this when budgets are tight?
think it's all about having really well structured pay structures and policies around promotion and those pay increases and those salary bands. How are they created? What are the definitions? How do you move from one to the other? And making sure that managers are able to explain that to the people that report into them. I think that's really, and it's true, it is going to open up a lot of conversation, and that's why we're really seeing this EU pay transparency as being a huge change management operation really for companies. It's a cultural change for some more than others, and being able to answer those questions and giving managers the tools for them to be able to confidently answer those questions is going to be a key aspect of the right implementation.
Brilliant. Unfortunately, we have run out of time. I see there are still a few more questions coming in. If you guys do have any more questions for Willis Towers Watson, for Valentina, for Lucie, please do go and visit them on their stand today, and they'll answer any of your questions and tell you how they can support yourselves and your organisations in this space going forward. So again, thank you very, very much to Willis Towers Watson.